My name is Dr. Lindsay Shirreff, and I am currently an assistant professor at the University of Toronto and an obstetrician and gynecologist at Mount Sinai Hospital in Toronto, Canada. The aim of this video is to discuss genitourinary syndrome of menopause, describe management strategies, and address common questions that arise when we treat this condition in our patients. So, what is genitourinary syndrome of menopause? GSM is a term used to summarize the effects of estrogen deficiency on urogenital tissues, including signs and symptoms of vulvovaginal atrophy or thinning of the vaginal tissues, urinary urgency, dysuria, or what we call painful urination, and recurrent bladder infections. GSM is a very broad term, and you may not have all of the symptoms. We used to refer to this condition as vulvovaginal atrophy, but it was a less inclusive term, referring only to thinning and drying of the vaginal walls and vulva that occurs in a low estrogen state. Many people ask us how common this condition is. Well, women at any age with low estrogen levels, regardless of the cause, may experience GSM. However, it typically happens in menopause, affecting 40 to 50% of all menopausal people. However, the number may actually be much higher because many people don't report their symptoms to their physicians, thinking this is a normal part of aging. Furthermore, symptoms can overlap with other conditions. So, what are common symptoms of GSM? Symptoms can start before your doctor can see signs on physical exam. As a patient, it is important for you to tell your doctor what symptoms you have. Symptoms can include genital dryness, decreased lubrication with sexual activity, bleeding with intercourse, irritation, burning, and itching of the vulva. Urinary symptoms can include painful urination, increased frequency of voiding, and urinary urgency. Your doctor will probably complete a physical exam. They may also complete other tests to rule out other conditions, such as infection or skin conditions. However, if you have been diagnosed with genitourinary syndrome of menopause, the focus of treatment will be around the symptoms you have. What is the approach to treating GSM? Our goal of treatment is to alleviate the symptoms you have. While other common symptoms of menopause, such as hot flashes and night sweats, typically improve over time, symptoms of GSM can actually worsen. In Canada, first-line management options include lifestyle changes, moisturizers, lubricants, and pelvic physiotherapy. Regarding lifestyle changes, avoidance of triggers that make symptoms worse can often help. Triggers can include soaps, detergents, chlorine, and spermicides that irritate the vaginal and vulvar tissues. You may also have identified other triggers that make your condition worse. Research also suggests GSM can be worse among people who smoke, and if you are a smoker, quitting can be helpful. For people with urinary symptoms, avoidance of caffeine, a well-known bladder irritant, is helpful. For those with incontinence, weight loss can help. We've talked about things to avoid. Is there anything we can do to help with GSM symptoms with respect to lifestyle? Genital stimulation and vaginal sexual activity promote blood flow to the area and may help maintain genital health. Moisturizers are another first-line management option. They may have been suggested to you already. These work by binding water and sticking to the vaginal tissues like a biofilm. If you are using moisturizers for the first time, remember they can cause irritation. A helpful trick is to test on a small patch of skin for 24 hours before inserting vaginally. Replens is a common moisturizer available over the counter for purchase in Canada.
Repagyne is hyaluronic acid. It is a vaginal tablet that gets inserted without an applicator. This is an over-the-counter option where the initial dose frequency is 1 ovule or 2 grams per day for 2 weeks, and then about twice a week thereafter. Hyaluronic acid will help with vaginal dryness and painful intercourse, and it may be a good suggestion for people who want to avoid hormones.
Natural moisturizers that are safe for the vulva and vaginal tissues include coconut oil, olive oil, and Crisco. Moisturizers can be used safely and be used as often as needed, but typical use is every 1 to 3 days. Lubricants, on the other hand, are meant to be used with intercourse and vaginal sexual activity as they reduce friction. They're applied just before the activity, and these lubricants can be water, oil, or silicone-based. There can be immediate relief, but there really is no long-acting effects. Pelvic floor physio can be helpful to some people depending on their symptoms. It can include intravaginal physiotherapy and can be helpful to those who suffer from painful intercourse. In Ontario, pelvic physiotherapy is a very well-regulated profession. To find a pelvic physiotherapist and to read more about it, you can go to the website www.pelvichealthsolutions.ca, where we often send many of our patients. Sometimes pelvic floor physiotherapists recommend dilators, and this can be tricky to navigate. A website we often recommend to our patients that is geared towards older women is www.middlesexmd.com. It may be worth taking a look if dilators have been suggested to you, but there are many other websites that do sell dilators.